chair recognizes the gentlelady from Texas, Ms. Escobar, for 5 minutes.
Thank you, Mr. Chair, and many thanks to our witnesses for being here today. I think it's really important for women in America to understand what's happening here. This is yet another example of how one of our parties in the two-party system, the Republican Party, is hell-bent on making sure that women do not have access to reproductive health care and cannot make decisions about their own futures. This is just yet another example of the messaging and the efforts to try to control women. And let me remind everyone again the difference between the two sides. Our side believes that we've got to take care of families and that we've got to make sure that children have a good future, and we did that by voting for paid family and medical leave. We voted for the expanded child tax credit. We voted for universal pre-K. We voted for affordable child care. All of this was just last Congress. And to a person, my Republican colleagues voted against all of that. So let's lift end the charade. And in fact, right now, part of the negotiations that are ongoing, both on the Farm Bill and in appropriations, as well as in the efforts for my Republican colleagues to default on our debt, involves taking SNAP away from families, in other words, taking food away from the mouths of children. But as part, if they can't limit women legislatively, they will bully and threaten those providers who help women and the women who use services. In fact, last year, because of the, and let me be clear, I don't believe anyone should be engaging in any violence or intimidation. All of us should reject all of that. But we're here really because we're chasing another conspiracy theory that is being put out there by my Republican colleagues. Last Congress, and again this January, I introduced the Healthcare Provider Safety Act, which would amend the Public Health Service Act to authorize grants to healthcare providers to enhance the physical and cybersecurity of their facilities, personnel, and patients. This bill would give providers the needed resources to ensure patients and providers are safe and able to continue providing and receiving this essential reproductive health care. I'd like to ask Ms. Camp a question. Ms. Camp, in your view, has the FACE Act been effective in helping to mitigate some of the violence, threats, and intimidation faced by abortion providers and patients? Do you think that FACE Act enforcement to protect abortion providers and patients could be stronger?
Thank you for the question, Congresswoman. Yes and yes, FACE has been an important tool in addressing the relentless violence, including murders and death threats against those who provide and access abortion care. But absolutely, as I said before, I mean, this violence is just relentless. It's so run-of-the-mill. Plenty of things that violate FACE our members just simply don't report because it's so run-of-the-mill for them.
It really has become run-of-the-mill. I met with a provider in Texas, one of the last few before Texas passed its historic and awful ban in our state. Who talked to me about how routine the threats and the intimidation had gotten. I spoke with a mother who had to undergo an abortion because the fetus was not going to survive and it threatened her life and would render her existing children motherless. She had to face intimidation as she walked into the clinic to receive care. And I'm running out of time, but I would just say that we need more programs to combat the kind of harassment and intimidation and violence that far too many clinicians and patients are seeing across America. Thank you for your testimony today. I yield back.
Gentlelady yields back, and the chair now recognizes the gentleman from North Carolina, Mr. Bishop, 5 minutes.
Thank you, Mr. Chairman. Mr. Houck, I just want to see if we can sum up. It sounds like the facts out of which you're prosecuting